make sure that you guys are seeing me. There's some internet connection issues, so I want to make sure that you guys are able to see me right now. If you are, please giving you about 10-15 seconds to come back in. I'm Maggie Yu, MD, functional and holistic medicine physician. And tonight we're talking about COVID, using NSAIDs like Motrin and Advil. And recent report today of French doctors saying that you shouldn't be using Motrin or Advil when you're dealing with fever, and that it seems to make COVID symptoms worse. I want to actually be able to separate fact from fiction here. What I would love for you guys to do is, if you are watching from YouTube, go ahead and click subscribe and click the bell to be notified when I'm live. And if you are not in our Facebook group, make sure you join our Facebook group, which is Transform Autoimmune Disease Naturally. And that's where I'm going to be going live every single night this week to really talk about some of these current headlines. What are medical truth and facts? What are some things that you can do to protect you and your family from dealing with this pandemic? And I'm really big about being strategic. So really here is about education on how you can be strategic. Those of you that are watching right now, if you're alumni, please let everyone know that you're alumni in our program, Transform Autoimmune, in the comments below. Those of you that are currently in the program, if you can let everyone know below that you're currently in the program, that'd be great. And people who are new watching this, tell me that you're new and tell me what some of your autoimmune symptoms you're dealing with are. And those of you who've been following me and watching this, tell me some questions you have about this topic around fever and COVID and how to deal with symptoms. Okay, so this is Restart. I know there was a connection issue, but I have a lot of content to go over, so I'm going to dive right in. So first of all, which is my question, first of all, is that NSAIDs actually make symptoms worse in COVID? It's observational. So there's a big difference between data and study-driven and proven and observational. Observational means that doctors in France are witnessing, and some other doctors have witnessed, that it seems to be that Motrin or Advil seems to make symptoms worse. So there's not like this large-scale study that says, oh, you shouldn't take Advil or Motrin if you have COVID. These are observational studies, observational recommendations from doctors in France who are seeing patients who take. Sorry, there was a connection issue. So that means that doctors are observing this. And what I'm going to tell you is that there are mechanisms why I personally don't like to take anti-inflammatory like Advil and Motrin, and that this is functional and holistic medicine root cause based, which is that you know for a fact already that aspirin we don't give to kids anymore when they're dealing with cold and flu, because it actually can cause some life-threatening side effects. And so doctors no longer recommend aspirin. And yet Advil Motrin works in a very similar pathway, okay? And what we also known side effects of taking Motrin and naproxen is ulcers, bleeding ulcers, okay? And so what we know is that there are mechanisms that disrupt the mucosal cells in your gut. Guess where else are mucosal cells? In your sinuses, in your throat, in your ears, in the back of your throat, right? All these places have mucosal cells too. So one of the reasons why I personally don't take NSAIDs on a regular basis is because, number one is, while it temporarily relieves symptoms, what you find is that it can have some really disruptive pro-inflammatory results on mucosal lining in the gut, and therefore it's not far-fetched that it may have some issues with mucosal lining in your upper respiratory tract as well. So I'm not telling you to never take it, and there's no data that says right now that you shouldn't take it, but there are French doctors who are saying that it seems to make COVID symptoms worse. So the question then becomes, people ask is, well, what should I take instead? Can I take Tylenol? Yeah, you can take Tylenol, and that's what they recommend. But long-term use of Tylenol is also something that I don't personally recommend, because there are no mechanisms with which Tylenol can be bad for your liver, and it can also cause problems with tons of what we call detoxification pathways of the liver. So we know that genetically some people can have some really big issues with Tylenol as well. Occasionally, can you take it? Yeah, I think so. But should you take it on a regular basis? No. But I think let's talk about fever on a bigger scheme here, okay? Why do we have fever, okay? And if you have, and Questions about fever, please put in the comment section right now. That'd be great. Fever is your body's response, okay? Its response to actually raise your temperature, to actually kill the germs or viruses that are hurting you, okay? It's literally a physiological response designed to actually kill the bug. And so for me, fever isn't a bad thing. And what we find is that fever under 103, 104, really, there's no danger in it. In fact, it is a pro-healing mechanism of your body to protect it and kill germs. So why would I even treat a fever? I typically don't, with medication anyway, because it's actually good, okay? But the question is, some people have asked in the group earlier today is, what if my kid has febrile seizures and I really want to keep that temperature lower? Well, what really reality is that you don't really get febrile seizures unless you're above 103 degrees. So if your child has 103 degrees or below, their chance of having a febrile seizure, if they have a history of that, is actually really low. Okay, so this is a very small population. I'm talking about febrile seizures. Okay, so in general, with fever, we don't really have to treat because it actually helps your body. So when you have symptoms of a flu, what are some things that you can do with fever that are natural? Let's talk about some natural things that you can do for fever that you don't even have to take anything for in case you want to deal with some of those symptoms, okay? So number one is that the quickest way to bring down a fever I know is taking a lukewarm bath. Okay, and the reason is because you are naked, first of all, so don't bundle up when you have a fever. Wear as little clothes as you can. And then going naked into some water is the quickest way that you can cool your body down. And I say lukewarm, I don't mean a hot bath. So, and I like to add a cup of Epsom salt in there because Epsom salt is very high in magnesium. And magnesium is really great to go into your body and helps with tons of mechanisms. And part of it is to help with immunity as well. Many enzymatic reactions in the body require magnesium. So a cup of Epsom salt in a lukewarm bath, totally the way to go. And that's the quickest way I know to bring down the fever. Number two is, of course, is the hydration, okay? Drinking fluids actually can help bring down a fever. And so I tend to, people will say hot versus cold. It doesn't matter to me. Of course, if you think about it, cold temperature can bring down your core temperature. Cold water can bring down your core temperature pretty fast. So drinking some ice cold water is great. But there is some Eastern medicine that says that when you're sick with something like this, don't drink ice cold and do more warm or lukewarm fluids. I enjoy both either way. I think that you can go either way. But when it talks about hydration, I want to talk about what are some things that you can hydrate you and your kids with when you have symptoms. And I think teas are really great. And I've done something with teas before, but I actually want to point out what I stock in my house right now is that why I like these particular teas. This is traditional medicinal. This is Gypsy Cold Care. And this one is Organic Echinacea Plus. Why is because they both have elderflower in it. And elderflower is actually known to actually decrease cold and flu symptoms, upper respiratory. It can actually mildly reduce fever as well. So that elderflower is really great. The other thing in here is echinacea, yarrow flower. That's the other thing that's really great. Yarrow flower is in this peppermint leaf. There is cinnamon. Cinnamon is a great ingredient because cinnamon really increases the circulation. Improving your circulation also helps actually break your fever as well. So cinnamon's really great for that. Cayenne is another one that's really great for that as well. So these are things you can buy at your local health food store right now, and you can buy it off Amazon as well. As doing some of these teas, you can make it as an iced tea if you want. I love, and there's licorice. The Gypsy Cold Care also has licorice root, and I told you guys how great licorice is in reducing symptoms. So some of the herbs that I'm talking about that are really helpful that are in here is elderflower. The yarrow flower is really great in here as well. And then cinnamon is really good. So in teas, this is what I would do is I do these teas whenever I have early symptoms with cold and known to reduce the symptoms, okay? Some of these herbs in here are known to reduce symptoms, okay? The other thing that I'm going to talk about is that when I do the herbal teas, we're talking about one of the other things that you can take orally is lemon juice. Lemon juice gives you a boost of vitamin C. It also has detoxifying properties. So you can also squeeze lemon juice into the drinks that you have. That'd be really great, okay? Those of you that are watching right now, if what's your biggest takeaway? If you could write in the comment what your biggest takeaway is right now, that'd be really helpful for me, okay? Tell me what the biggest takeaway is. Now, I like to drink, when you're talking about drinking, is apple cider vinegars are actually really great. And I like to actually, I love this particular brand. This is what I stock at home, and I've talked about this before. But this is a brand called Wetherspoons, and it's apple cider vinegar. Now, apple cider vinegar also, you can put some of it into, I put it in with some warm water and just drink it. You could use it to add to teas if you wanted to. You could cook with it. You could make salad dressings with it. This particular company has apple cider vinegar that has Manuka honey. Manuka honey has great immune boosting properties. They actually have a couple flavors. This is the black currant formula. That's really immune boosting. Black currant has immune boosting properties, so apple cider vinegar is great. This particular one formula is the detox with ginger and turmeric. Ginger and turmeric are great for immune boosting as well. They call it detox formula, but it's really great for cold and flu as well. Okay, so those two would be some medicinal foods that you can add in. That's really great for dealing with some of these symptoms. Okay, now I want to talk about is probiotics. Okay, probiotics is really great, and when I talk about probiotics, there's two. So for kids, I like showing bottles too. So for adults, my favorite right now, this is my favorite period in our program, is we use ProFlora AI. Why I like this particular blend is it actually has several strains of the lactobacilli that actually helps other strains grow and stay in your gut. But what's really cool is this particular blend also has the bifido, and then my favorite, Saccharomyces boulardii. Saccharomyces boulardii is the strain that I recommend and our nutritionist recommends specifically to help people ward off infection. So this particular probiotic is amazing for autoimmune, but I take it every day to help prevent cold and flu and to also treat early symptoms, because if you have good bacteria in there, it's going to kick out bad bacteria. This is part of our cold and flu bundle, and Cora has put that bundle link below if you want to check it out. But this ProFlora AI, it is indispensable. You got to take it every day, and if you don't take it every day, as soon as you have early symptoms, make sure you take it because it can fight off early infection with Saccharomyces boulardii. Okay. The other thing that I like is for kids, chewable formula is really important. If your kids can swallow, give them this one. Okay. If they can't and they like a chewable, this is what my kids take. My daughter, 16, still can't swallow a capsule, so she takes this one. This is a chewable, and this particular formula is lactobacilli with bifido, which is a really great combo for people dealing with autoimmunity, but also kids of people dealing with autoimmunity and trying to boost their immune system. So this is, once you receive it, it doesn't have to be shipped refrigerated. Once you receive it, you can refrigerate it if you want, but it's shelf stable to 95 degrees. This is the probiotic of choice to have kids take every single day during cold and flu season for me, for everyone in our program. So those two are really great. Okay, I'm trying to keep these in the store. Like literally, there so many of the products in our store are getting sold out, and we're having major supply chain issues. But we just got 30 bottles of this in, so if you want to grab it, grab it. The other thing that we're going to talk about is elderberry. Elderberry, I want to tell you guys why it's so great. We just got, again, this is on short supply because elderberry syrup is sold out everywhere. But we just got 30 bottles of this in, so grab it if you want it now. Elderberry, especially for kids, I think is a really great formula because elderberry has been shown in studies to actually really boost mucosal cell function, help with natural killer cell function, and it's been shown to decrease some of the symptoms of influenza and colds. So, and it's so easy. It tastes great. So my kids used to do this on pancake syrup. I used to have them use it as pancake syrup, and it is really, you can put it into teas. You can put it even into a drink for them. It tastes great. It tastes like blackberry syrup, literally. Now, some people think that you shouldn't take elderberry if you have autoimmunity. I'm talking to the adults here. And that's more of a theoretical risk. I've already addressed it to death, but I'm just going to say that there's a theoretical risk that people propose. But clinically, there's very little evidence that we've really seen elderberry flare people with autoimmunity. And I have been using elderberry in our program for 10, 12 years, and I've never seen someone flare with it. And I've talked to many clinicians out there as well, functional clinicians, and all of us have used elderberry in the autoimmune population without any issues. But at the same time, some people keep pushing it as there's some theoretical problem with it. If you're afraid to use elderberry, don't use it. Okay, we have plenty of other products that don't have elderberry. We have one product called Virus Strike. Virus Strike is for what I use right when I get sick, and it has the elderberry in there. It's got elderberry in there, it's got the olive extract, and it's got Immunogard in there. Those three ingredients are really key, and all three have been clinically shown to have really big results with decreasing the duration of symptoms and even transmission of the influenza virus or cold and upper respiratory infections. So something to think about is I think of the Virus Strike in the store as what I call the Viral Z-Pack. That's how I think of it myself. As soon as I get symptoms, I go ahead and take the Virus Strike, and it's just 2 capsules every single day while you have symptoms. So have that on hand. Don't wait till you get sick for that to happen. And again, that one we have about 30 left right now in our shop, and there's some supply chain issues. But if you need it, get it. It's called Virus Strike, and it's got the elderberry, and it's got the Immunogard, and it's got the olive extract. All of them data driven to actually decrease symptoms and some of it transmission as well. Okay, but elderberry, again, kids, I use this all the time. Very, very safe, high safety profile. Really effective. I have this at home. If you have a child, the probiotic, those two things are a must-have in the home to deal with if they have symptoms. The other thing that I want to talk about with kids, and I'm going to talk with you guys about, is vitamin C. You've got to have some vitamin C on hand, because vitamin C, data-driven, has shown to increase natural killer cell activity. Natural killer cells are your neutrophils, the ones that are actually like Pac-Man that eat up viruses. Okay, so this is like the strongest thing you can do is stimulate your natural killer cells if you're trying to kill viruses. And one of the most potent way to stimulate that is actually vitamin C. Okay, and with vitamin C, some of the things to think about is that the doses that you need to take to actually, when you have symptoms, is pretty high. Like in adults, I'm talking about like 2,000 to 3,000 milligrams, which for most people, you're gonna have a hard time stomaching it. And so for me, getting a really good quality vitamin C that you can go higher doses at, that you can absorb and tolerate, is really key to fighting infection early. And the sooner you get the C in, the better, okay? And so for me, like with the kids, we have the chewable here, and this is a highly absorbable one. It's 250 each. So if you have a young child, you're trying to do 500 milligrams, I would definitely, on vitamin C, this is a key tip, write it down, split dosing. So you want to do a dose in the morning, a dose in the evening, because it's water soluble, so it gets out of your system pretty quickly. So you want to continue your system in your body to have vitamin C. So you want a form that's really absorbable, doesn't upset your stomach, and you want to take it twice a day. These particular supplements, guys, I've curated specifically for people with autoimmunity and not. So a lot of people are asking, if I have autoimmunity, can I take this? Can I take that? And I'm going to tell you, these are specifically the supplements that I recommend for people with autoimmunity. Again, if you are uncomfortable with any of the ingredients, there's plenty of you can build your own pack, okay? You don't have to be like, oh, I have to get something with elderberry. If you're uncomfortable with it, you can pick up items that don't. Like this vitamin C is great. The probiotics are great. You can build your own immunity pack for prevention and for treatment. Okay, so this is a chewable vitamin C that's 250, and I would split it up with your children. It tastes great, and so you would take one in the morning, one in the evening, be about 500 milligrams. Again, adult dosing, if you're really actually dealing with getting an infection, would be closer to like 3,000 milligrams, which is why this ultra potent 1,000. I would just have you take like 2 in the morning, 1 at night. That's 3 to 4,000 milligrams for adults. It's the kind of dose that you're really talking about with dealing with an infection. And I use that dose for prevention anyway. I'm taking 3,000 every day for prevention, and that's in our prevention pack. I don't want to go into prevention tonight because there's a whole bunch of stuff that I could talk about prevention. I'm really dealing with symptoms right now. And for me, it's not the fever that you should be focusing on. Fever is not a bad thing, okay? It's almost like if it's under 103, don't even worry about it. If it really bothers you and you really want to shorten the duration of this and decrease the progression or transmission of it, these are the supplements that I'm talking about right now that are helpful. And these are the lifestyle and food and some of the changes that you can do right now with it. So it's not all about supplementation. I mean, while that's important, I wanted to, did I miss anything? Okay, guys, make sure you're on vitamin D 5,000 every single day with autoimmunity, and make sure to get your vitamin D tested with your doctor also. But vitamin D is huge antiviral. We have a 5,000 in our immune building pack. That's a great dose to take every single day to deal with early signs of infection. Vitamin D known to actually be helpful with data driven for infections. Okay, I recommend this for kids with acne all the time. My son's on this for his acne and he takes it every single day. Great for autoimmunity. That's part of our immune pack. And then, if you wanted Sinuplex, I want to really talk about this one, quercetin. Okay, let's talk about quercetin. Quercetin is really great because it is great for dealing with allergies. And there's always some sort of allergy component for a lot of people with asthma, with allergies, and especially if you have asthma and allergies and you get a cold and flu and you get that cough that doesn't stop, you're in big ass trouble, right? That's me as well. So a lot of us with autoimmune have a lot of allergies and we have a lot of asthma or allergic type symptoms. Quercetin is amazing for that, and you want to be talking about really hefty doses of good quercetin. The other herb that's really good for that is stinging nettle, okay? And of course, vitamin C. Those three are really great for dealing with people who are special consideration, asthma, allergies, or you get that post-cold bronchial cough that doesn't end. I really recommend this particular product is a combination with all three of those things, which is called Sinuplex, which is part of our immune bundle that you can build yourself. And when you look at this this product, it's got the vitamin C, it's got quercetin, and the quality of this quercetin is amazing. It's got stinging nettle, and it's got NAC. NAC, guys, you know how good that is in detoxification, how important NAC is in boosting immunity. So many of you with autoimmunity are taking NAC, and it's super helpful. Well, it's helpful for cold and flu as well. So Sinuplex is a great formula. It doesn't have mushrooms, doesn't have echinacea, doesn't have elderberry. It's a formula that's quercetin, stinging nettle, vitamin C, NAC. Super good formula, and it's cheap, okay? So what I do with it is, this is pro tip, guys, is if I'm just dealing with trying to prevent asthma or allergies, I take 2 a day. If I'm having a flare or I'm sick, I'm going to take 3 twice a day, which is 6 a day. This is how I do it. So Sinuplex is a great way to go. If you're trying to build your own formula and you're sensitive to this item or that item, that would be a great way to go, is if you have symptoms or prevention. Is this making sense? Is this too much, for everybody, or is this helpful? I'd like some feedback right now. Is this super helpful? What was the biggest takeaway right now? And I'm going to try and see if I have any time to answer some questions here. But I want to bring up a really important point before we transition to questions, which is that I want to talk about focus. Everybody's focusing today on fever, and fever is actually good. I don't even mind having a fever, right? And everyone right now is focused on COVID and the pandemic. But I really want to point out something really important for everybody dealing with autoimmunity here. The biggest threat to you and the health of your family is not COVID. It's actually your autoimmune disease out of control. And I'm going to point this out, which is that your immune system in autoimmune disease is supposed to work for you, which means you're supposed to be able to look at germs outside you and say, you're a germ and I'm going to kill you. But in autoimmunity, your body's looking at your body and says, you're a germ and I'm going to kill you. So if your body's trying to be busy killing yourself, how likely and how good is it going to be killing germs? Very, very poor. So all of you stressing out about COVID, stress is actually making your autoimmune flare get worse. Okay? Your autoimmunity is going to be suffering. Your biggest threat to your health and your family's health is your autoimmune out of control. So the most important thing you could do to protect you and your family is to actually do everything that it takes to actually chill out, decrease your stress level, and help calm down your autoimmunity. This is why I'm bringing this up, because people are like, well, then how the heck do you calm your autoimmunity? And that's what I call 5 pillars of our program. If you actually do all 5 pillars of our program at once, that is the quickest, most effective way to actually get your immune system to work for you instead of against you. There's so many alumni watching here right now. Alumni, tell people what has happened to the frequency with which you get sick, the severity of your sickness, what has happened to your asthma, what has happened to your allergies. Now that your immune system is working for you, how good is it at killing germs now? Okay, and this can happen within a matter of weeks in our program. Okay, so if you guys are interested in learning what the 5 pillars are to really turn around autoimmunity, write 5 pillars in the comment section, and Cora's going to put a link. You guys can register for a training I'm going to do next week, and that's not going to be live to the group. I'm going to do it with you guys next week. Register for the training, and I'm going to talk about the most important thing you should focus on is calming the hell out of your autoimmunity now. That's the focus that it should be on. Because here's the deal. If you get into a flare right now, what's going to happen? You're going to end up in urgent care or the emergency room, okay? Where there's no beds, or there's going to be people that are all filled with people sick with upper respiratory and COVID exposure. So the most important thing for you to do right now is prevent a flare over the next 6 to 12 months. Does this make sense? Right? So focus is power. So I don't want the fear to make you focus on being reactive, and it's all about COVID pandemic. Don't lose focus on turning around your autoimmunity now is the most important thing you and your family can do for your health and their health as well, and to decrease exposures, okay? All right, so I'm going to see if there's any questions that you guys have. I'm having any questions. 5 pillars. Oh, love it. So many of you want to. Okay, great. Don't get ill. Don't get allergies. Tracy, you're right. Tracy is a graduate of our program. She doesn't get sick anymore. She doesn't get allergies anymore. Debbie. Have issues with swallowing capsules and swallowing pills. Can I chew Sinuplex or capsules if they're open? The Sinuplex actually is a tablet, okay? So it's not a capsule, it's a tablet. You absolutely can chew it. But here's the deal. I was just talking about this in the mastermind training in our program, and someone was talking about how do you get quercetin or stinging nettle into kids. I have yet to find a really good chewable or liquid formula. So I don't have a great answer for you there. If you want to you can find stinging nettle liquid on Amazon if you wanted to do that. But to me, you don't have to do Sinuplex. Like, there's so many chewable formulas here. Like, the chewable potency is really great. That's really a good option. If you really can't swallow the other one is the chewable probiotic. You can do this as adults, okay? And then elderberry syrup, guys, you can do as an adult too. The dose for kids is for kids and adults is the same, which is elderberry syrup is 1 teaspoon twice a day if you're sick. And it would be 1 teaspoon once a day if you're trying to prevent. I don't like doing this necessarily as a preventive every single day, which is why it's not in our prevention pack. If you go to our bundle store, you can actually see we have a med pack for prevention that you do every single day. This is our 30-day pack. But I don't want to get into that right now. You can see it on the website. I really want to talk about what to do when you have symptoms rather than on prevention. So for people who can't swallow, like the chewable, getting a really good chewable vitamin C like this, a chewable probiotic like this, and elderberry syrup specifically, these are the 3 items that I found in autoimmunity to work really well, and it's totally good with for people who can't swallow pills or capsules. Okay, I hope that helped answer some of the questions. Let's see. Any other questions? Let's see. People are finding it super helpful. I'm so glad. I'm going to be live every day. Here, someone asked how you can share this. So when the very next day after I go live in the group, we're going to be posting this onto our YouTube channel. Can you guys, can Cora, I will add a link to my YouTube channel. If you can click the YouTube channel and subscribe to our channel, you can get notified every time. The next day we're going to post these videos, and you can actually share the YouTube videos with anyone that you want. Instagram, you can follow me on Instagram, which is at maggieyu.md. We also post live into Instagram, and we're going to be there's going to be a lot of content that's going to Instagram over the next couple weeks as well. So those are shareable content that you can do. Okay. Let's see, other questions. Where can I get the immune pack? Oh, okay, Alice and Madison. So the immune bundle is actually Cora's going to put the link. It's all the curated products that I have in this that are great for people with autoimmunity dealing with prevention of cold and flu or treatment of symptoms. I'm going to talk about prevention on a different day. There's just too much in one, and I don't want to over inundate everyone. So I would like to pretty much end right here, and I'm going to ask you guys tomorrow, I was going to do kids specifically tonight and supplementation and nutrition, but the whole article with the fever and NSAIDs really threw everybody off, and I really felt like that was a better focus, is to focus on clarifying that if you occasionally need to take, personally, I don't want to treat a fever. If you occasionally need to take something, Tylenol would probably be preferred over for an NSAID, cold and flu symptoms, but only occasionally and not every day. And then supplementation, lifestyle, all the way. There are just so many better, more effective things that you can do that don't harm you, potentially harm you. And I went over some of those. I hope that's been helpful. Tomorrow night, I'm thinking about kids and dealing with cold and flu, special consideration in children, and maybe even nutrition in kids. Does that sound cool with you guys? Okay. And if you know anybody who could benefit from learning about cold and flu and my lives every single night here, can you add them to the Facebook group? Just go to the right side and in the Facebook group and just add their names and invite them to the Facebook group. And we'll let them in, and so they could actually do this as well. People are like, please do the kids. Thank you, everybody. Gosh, I love all these comments and the engagement. Kylie says, Kylie from Australia, graduate from our program. Can you do a prevention live and a kids live? Yeah, I will do a kids live, Kylie. I think tomorrow night we'll do a kids live. There is a lot of community issues and stuff right now because everyone's on the internet and trying to do everything virtual. So I will absolutely do kids tomorrow, unless something else comes up. I also, guys, asked you guys if you guys wanted me to share something new. That's great, which is the early moon. We talked about yesterday on the live mindset and how important routine was, especially in the time where we're doing social distancing, how important maintaining connection is and how it's creating unique opportunities. If you guys missed last night's live, please click the link. If you're on YouTube, check out the social distancing video and watch that, because we really talk about what are some of the things opportunities that it's creating right now. And one of the things I talk about in there is routine. And I'm wanting to do a special training for you guys just to talk about what is a killer morning routine to do every single day to help you stay calm and manage crisis, and a strategy to win. My friend Alex Sharfin, he's just incredible. And he had shared a live video about his morning routine and what people in his program and his family does. And I literally started to do it recently, and it's been a game changer. So one of the lives I'm going to do is to share the morning routine with you guys. And I'm going to egg Alex on to actually do a live interview with me so he can teach it as well with me. How do you guys like that? So I literally have a power pack week for you guys. And here is the most important thing. This is a give to give you guys and help you guys prepare a strategy to deal with the pandemic, layer by layer by layer by layer by layer, and help you focus on the most important thing, which is you really need to focus on turning around your autoimmunity now. That is the eye on the prize, people, and don't forget that. So have a great night. I hope that's super helpful. And if you guys can give me some kudos here with some loves, some hearts, if you guys can go over to the YouTube channel right now and subscribe to the channel and share. I'm gonna have Cora post a link to the social distancing video and the YouTube channel. Click on that link and just subscribe and share the channel with everybody every single day. Like tomorrow, this video is going to go live into the YouTube channel. So if you share that channel, anybody outside this group can actually watch my videos the very next day. So that would be super helpful. So love it. So I hope that was super helpful for you guys. And as always, if you would like to talk to our team about turning around your autoimmunity now, we're also going to post a link. You can schedule a call with us. And we have a 2-month program to launch people into turning around their autoimmunity just in 2 short months. And if you're interested in doing that now, taking the time, since you have time to do that, people talk on no time, and now you have time, go ahead and click the link to actually schedule and book a call with our team. Have a great night, everybody. I hope that was super helpful. Thank you.